Welcome to Boomer Being. As a follow-up to our last segment on acupuncture, we're going to discuss and demonstrate a few different techniques. These acupuncture techniques are known as cupping and Gua Sha. Then we'll be exploring Chinese herbal medicine. Our expert guest today is Rebekah Michales. Rebekah is a graduate of the New England School of Acupuncture, the oldest acupuncture school in the United States. She is board certified in Oriental medicine and auriculotherapy. Welcome, Rebekah.
Hi, Leslie. Thank you very much for this opportunity to demonstrate these techniques that I like very much to your Boomer Being audience.
Wonderful. So why don't you tell us a little bit about your practice and what you'll be demonstrating today?
So I'm a licensed acupuncturist and a Chinese herbal medicine dispenser. In my practice, in addition to the acupuncture, I use a lot of adjunctive techniques. Two of my favorite adjunctive techniques are cupping and Gua Sha. Your viewers may have been familiar with cupping. This is a classic fire cup from, I think it was 2004, when Gwyneth Paltrow showed up at a film premiere in New York City with cup marks all down her back. And they're very distinctive, and of course everybody asked about them. And she did a really good job of explaining what the cupping was for, and people started to know about cupping. Gua Sha is another technique that is somewhat similar to cupping. It's usually done with the top of a can, the rounded edge, a ceramic spoon, or specifically made, this I believe is buffalo horn tool. And it is a scraping technique that is used on many parts of the body, but mostly on the back. Both of these techniques are really helpful for pain conditions. For example, many of us spend lots of time crunched over our computer, not sitting up straight like we should. So we develop a lot of muscular tension. So probably the single thing that I treat most with these techniques is upper back, neck, shoulder pain. And that may be pain that's been going on for years and years and years, or it may be something more acute. These techniques are also good for things like asthma, especially for children, because you don't want to pump them up too much on the asthma medications because they have long-term side effects. But you can really ease their breathing by judicious application of these techniques. A lot of times what happens is people recruit other muscles, not real breathing muscles, to help them because they're trying so hard to breathe. The cupping and the Gua Sha are both techniques which really release those muscles and improve breathing. One story that I really love and that just tells you how pervasive these techniques are is when I was in acupuncture school, my grandmother came to visit, and I was showing her my kit, and I pulled out the cups. Now, my grandmother was very old. She was probably about 92 at this time. She recognized the cups immediately. And she told me a story about my grandfather, who was a barber. At night, after the day was over, clients would come to his house and he would cup them. He would cup their backs if they were sick or if they had pain. So I just thought it was super cool. I mean, my grandfather was a Russian-Polish barber, and here he is using this technique that we see today as East Asian, but it's a global technique.
And you didn't know?
I did not know that, and I was really I was kind of thrilled to think that, in some way there was a healing tradition in my family and that I was following in his footsteps.
That's lovely.
So my colleague, Marie Dallenkeen, has generously volunteered to help me demonstrate some of these techniques. So I'd like to bring her up and show you how this works.
I look forward to it.
Okay, so Marie has generously offered her back here for me to demonstrate these techniques. So I use a suction cup. The classic is the fire cup, which you create the suction by introducing a burning cotton ball. You saturate it in alcohol, you light it on fire, you put it in there, and the temperature differential creates the suction, and you're able to have it adhere to the person's skin. Problem with that is when they fall off, it takes a long time to put them on, and also you have fire near people's hair. So I use suction cups, which are not quite as pure as classic, but they work very well. And when they fall off, they're easy to put back on. So as you see, the skin is sucked into the cup. And as the cup is left on here for a while, it will start to turn a little bit purple. Now, cups are generally left on between 10 and 15 minutes. And when you take them off, there will be a purple mark there, a round purple mark, like you've been attacked by a moray eel or something. So these marks are very distinctive. And this is what people saw on Gwyneth Paltrow in her beautiful strapless gown. So this is a very classic technique. The cup is just left here, and you would put multiple cups on the person. Another technique, it doesn't hurt at all. You feel a sucking sensation, but it's not painful. Another technique, and one that I use very frequently because it's extremely effective, is something called sliding cups. And for sliding cups, we just put a small amount of some kind of a lubricant on the skin, and then we use usually a slightly smaller cup, and we put this on the lubricated area.
And this is to treat pain.
This is to treat pain. It can also be used to treat, for example, I would do, if Marie had chronic headaches, I could cup her upper back, which would release a lot of the muscles that pull on the skull and that could cause head pain. So this technique, the cup is slid across the skin, and you see that gradually the skin will become a little bit red, and you might actually bring up petechia, which are small red dots. This is, it looks, you're thinking that this is painful, but really this is not painful at all. It's a very gentle massaging sensation, but it works deeply into the muscles. Very, very effective for pain conditions, but also for internal conditions. For example, people who have a lot of digestive problems, we would work on their lower backs, lower to mid back. Asthma, we would work on their upper back. Headache, we would work on their upper back. But if they had sciatica or something going down their legs, we would work on their lower back. So this is a very good technique. Now, it does leave marks, so this is not something you want to have right before you go to a pool party, or even before you go to your primary care doctor, unless you want to explain. Our cultural competency has improved a lot, but in the early years when this first came to the country, and specifically after the Vietnam War, when there were a lot of refugees coming to the country, these are folk techniques that people would do in their families. And sometimes Western medical practitioners would not understand when somebody came in with marks what they were seeing. And that led to some really unfortunate situations where people were being accused of battery.
Now, how long do these marks last on the skin?
So that's a really good question. These marks can, depending on your constitution and how fast you heal, these marks could last from 3 days to 7 days.
Oh, I see.
And sometimes, like in acupuncture school, when people get a little overzealous, sometimes they'll last a little longer than that. But once you've been practicing for a while and you get a sense of your client's constitution, you scale the treatment to what is appropriate for them. Yeah. So that's cupping. Another technique that I really love is called Gua Sha. And Gua Sha is a scraping technique. Again, we're lubricating the skin. And this is to protect the skin. We want to work below the layer of the skin. Now, this is a technique that you will often see if you see pictures of China. You'll see this done in the market with something like this. This is a buffalo horn tool. But in this era, where we're very aware of having universal precautions and not spreading any kind of disease, we really are very fond of disposable tools. So this simple bottle cap with a nice rounded edge is a perfect tool for this. I can use it on my one patient, and then I can clean it and dispose of it, and there is no chance of any kind of cross-contamination. So this is a scraping technique.
Again, this is used for pain?
This is used for pain. This is a really interesting technique because this technique has been shown scientifically to improve microperfusion of the tissue. That's so, okay, already, sorry, I'm going to interrupt a little bit. Already, you see these red marks here? These are petechia. So the technique here is to raise therapeutic petechia in the area that you're treating. And you want to do it evenly. So short, unidirectional strokes to raise these petechia. And in a person, now Marie is a massage therapist, so she works with her body, and she develops areas of stagnation, areas where the muscle is not getting the kind of nutrition that it wants and needs to recover fully. So this technique brings a huge amount of blood circulation to this area. Oh. In addition to blood circulation, it also causes the expression of an enzyme called hemioxygenase 1, which is a very potent antioxidant that the body produces that works as an anti-inflammatory. So now I promise to finish, Marie, at a later date. But you can see these petechia have shown up. Now, as the day goes on, sort of probably by this evening with Marie, because she does heal very quickly, this will start to look almost like a hickey. And then from a hickey, it will turn into a greenish yellow bruise. And then within 3 days, this will be gone. Now, what she would feel would be initially a loosening of the muscles and a greater freedom of movement. And then, there wouldn't be any pain associated with it. It's not like you've been hit or beaten. So although it is dramatic and it does create these marks that do last for a couple days, it is not painful, but it is extremely helpful therapeutically. So thank you very much, Marie. I appreciate it. And I promise I'll finish that at a later date. I won't leave you lopsided.
Thank you very much for that demonstration. I've already learned a lot. I've never seen that done, and it was fascinating.
I think a lot of times people are scared because it is so dramatic visually, but I think try it. It really might be a very helpful thing, a helpful tool to have in your arsenal of things that can be done to help your body feel better.
Excellent. So I think it's time to switch gears now and talk about Chinese herbal medicine. So I'd love it if you could give us just a little brief explanation of what that is, how long it's been around, and what you've brought to show us.
Okay. So Chinese herbal medicine has a very, very long history. Safe to say 2,300 years of written documentation. In 1973, there was an excavation in Hunan province in China where they opened up a very famous tomb called the Ma Huangdui tomb. And they dated that tomb, carbon dated it to 168 BC. So very, very old. In that tomb, there were silk scrolls with herbal remedies on them. So they weren't talking so much about individual herbs, but giving prescriptions. So in the course of reading these ancient scrolls, they found that they referenced 250 different herbs, most of which were vegetable or plant in nature, but some minerals and some animals. So that's safely 2,300 years of written information. When you think that penicillin was only introduced in 1930, Fleming won the Nobel Prize for his research on penicillin. But the blue bread mold that penicillin came from was around for many, many years, obviously, before that, and people were using it. Likewise, aspirin. Aspirin comes from willow bark. Aspirin, salicylic acid, the predecessor of aspirin, is referenced in Hippocrates' work. And that's 330 BC. So this stuff is very, very old. And what I think is so interesting is that there are written records, and the bad stuff has been weeded out. Mm-hmm. So the herbs that we use, while not 100% benign, if they're used by a trained practitioner, are very effective and also very safe. So herbs come in many different formats, so I wanted to give you some ideas. So we have here 4 different herbs. This is Chen Pi, which is tangerine peel, dried tangerine peel. So if you smell it, you get the citrusy, you can break it or smell it, you get a sort of a citrusy tinge to it. That is very helpful for digestive issues. This is white peony root. So the same white peony that you have in your garden, these are the roots, they've been dried and processed. It's very hard, you almost feel like you could carve it.
Do you soak this?
So these are raw herbs. So if you went to a pharmacy in Chinatown and you asked, you got a prescription for yourself depending on what was wrong, they would give you a bag for each day of the week that would contain, 2 slices of this, 3 slices of that, a handful of this, and you would take that home and you would boil it. And you reduce it, and then you'd add more water and boil it again, and at the end of your cooking experiment, you would have 2 servings, and you would take it morning and evening.
Gotcha.
So that's the classic way that Chinese herbs are dispensed. Now, when I first started taking herbs, I did take the raw herbs, and I boiled them up every day, and my husband hated it because he couldn't stand the smell. It was, I'd stain, you had to do it in a special pot, an enameled pot or a ceramic pot as opposed to a metal pot. And he hated the smell, and he said it discolored the pots. So that was my first introduction to herbs. Now, as a practitioner, I dispense powdered herbs. So I poured some in here just so that you can see. They almost look like sand or like instant coffee granules.
Yeah.
So much, much easier to use. So I would make a prescription for somebody that would have maybe between 18 and 22 different herbs in it. And they would go home with a bottle of these powdered herbs. And they would measure out a certain amount, and they would add hot water, stir it, and slug it down. Now the bad news is they really don't taste very good. They tend to be very bitter. The good news is that they're very effective, and they have very few side effects.
So when we're talking about, I know there's a whole range of herbs here, but what maladies do you typically treat when someone comes in for this kind of?
We treat all sorts of stuff. Now, for your boomer being audience, some of the things that are maybe most pertinent would be, we treat a lot of menopausal symptoms. For example, hot flashes, night sweats, that foggy brainedness that comes when you're not getting really good sleep. We are very effective at that. So for people who, for one reason or another, aren't eligible for hormone replacement or don't feel comfortable with that, this is a way to get those symptoms under control and get your life back. Very, very helpful. For the men in the audience, one of the things that we treat a lot of is prostate issues. So as you reach that middle age, you may experience urinary problems, discomfort, pressure. Chinese herbs are really good at resolving that and making you a lot more comfortable. We treat headaches, we treat digestive issues, especially chronic digestive issues like Crohn's disease, for example, can be very well treated with Chinese medicine. IBS, more acute things, like if you have a stomach flu or something, can also be addressed, but that means you have to get to me quickly or another practitioner quickly, because you're not going to have most of this stuff lying around. Although, these here are patent medicines. So these are medicines, Chinese herbal medicines that have been pre-prepared. There is a group of very simple formulas that have been made into pills. So these are classic. These are called tea pills. Very easy to take. They're just little sugar-coated pills. This is a medicine for headaches.
Oh.
I like this one a lot. It's for that headache that you get at the back of your neck that kind of wraps around like a hat band. This is a great headache remedy for that.
Interesting.
Yin Chow, people love to have this in their medicine cabinet because this is the thing when your kids are sick and you think you might be getting sick, you have that scratchy throat and just a little bit of achiness. You're not really sick yet, but you're getting there. Yin Chow is the thing that you take to try to ward that off and prevent it from becoming a full-blown cold. Yin Chow is also one of the small formulas that is at the root of the larger modern formulas for things like SARS or for H1N1 flu, the new flus that are coming out. these herbs are paramount to those formulas.
Very interesting. Brings me to wonder, are these Chinese herbs regulated in any way?
Yes. Now, this is something really important that most people don't know. Chinese herbs are regulated by the FDA. Actually, this one I brought specifically so that you could see this label. This is Gua Sha, and the FDA has determined that the maximum dosage on this is less than 1.2 grams per day. So the FDA has studied this herb. They have determined that in dosages larger than that, there's toxicity. So herbs that have, FDA regulations will be marked. There'll be a sticker on the bottle. And it's really very few herbs that are, regulated in that way. However, there are other herbs that we can no longer get in this country. MOAM, which is ephedra, very effective herb for asthma. But unfortunate side effect is a diuretic, and if used incorrectly or in excess quantities can cause kidney failure. So we can't get MOAM anymore. So we have to work around that and use other herbs. The FDA regulates the individual herbs. The issue, I think, for them is that as individual practitioners, we make customized prescriptions for each of our patients. So there's no real effective way that they can regulate each of those prescriptions.
Right.
They can regulate the individual components, but not the whole formula. So at that point, you have to trust to the education process and the board exams and the continuing education that we need to do every 2 years to maintain our license.
Now, I'm sure that people can go online and perhaps find some of these herbs. What would be the difference between what you dispense and what an average person could find online?
Okay, so that's an excellent question. So a lot of the patent medicines like this are available on Amazon, and in fact, I send my patients to Amazon or to other online providers because they're less expensive, and if they're using something on a regular basis, they can do that. A customized prescription, however, is just that. You need to see a practitioner. You need to have sort of an in-depth medical history done. The practitioner needs to know everything, not just about your allergies, but about your digestion, about all the other things that come into play, so that the prescription will be balanced and cause minimum side effects.
So, taste-wise, if I were to, I heard you say that there might be a not so pleasant aroma. What about the taste?
So most of the Chinese herbs are kind of bitter. I'm not a coffee drinker, but I've been told that they're like really kind of bad coffee.
Oh.
The way, for example, when we give them to children, often what we do is we'll put them in a little bit of applesauce or a little bit of chocolate pudding. You just mix it in. It doesn't dissolve in the applesauce or the chocolate pudding, but it slides down. It'll dissolve in your stomach. It masks the taste. For myself, I'm so used to them. I just add hot water. I wait till it cools down. I shoot it, and then I have a piece of chocolate or some peanut butter. Take the taste away.
So we mentioned some of the maladies. What popped into my mind was cancer treatments. Do you treat cancer?
In the United States, generally we don't treat cancer. We treat the symptoms of the cancer, and we treat the side effects of the traditional therapies, the chemotherapy or the radiation therapy. The herbs that are sometimes used in China for actual treatment of specific cancers are for the most part fairly toxic and mostly not available in this country. And I think the general as a profession, we have decided we should perform a supportive role in this and let the very effective chemotherapeutic agents do their job.
Excellent. Now, what about in conjunction with other therapies? Do you find people come to you and they might also be doing maybe physical therapy or some other healing art?
Yes, absolutely. And I have always felt myself that a multi-vector approach is the best. When you're uncomfortable and you're sick, you want that to change as quickly as possible. So without exhausting yourself, adding multiple therapies increases the speed of healing for the most part.
I bet you're very, there's a lot of gratitude when you make someone feel better.
It's really, It's very cool. You feel good, you feel happy for your patient, you feel like you've accomplished something worthwhile. Yeah.
Sure. So what are one or two of the greatest success stories from your career as a healer?
You know, there are so many different patients, but recently, you know, two things spring to mind. I had a patient who, 42, very much wanted to have a baby. She was lining up for her 5th IVF try, and we were doing some herbs to get her ready for that and balance her body to get her in the best possible space so that this would be effective. And we'd done about 3 months of herbs. She was just getting ready to start the IVF process, and she got pregnant.
Oh my goodness.
So she got pregnant naturally using, you know, this technology to balance her body, and that was, you know, I mean, that's about as good as it gets. Another patient recently, labyrinthitis, which is an ear problem that results in vertigo and dizziness and nausea, and it's really unpleasant and very hard to push through. So a patient called me, and he had been sick for about 3 weeks at that point. I sent him a formula, and his dizzy spells and stuff stopped within 3 days. So he needed to continue to take those herbs for a little while, but it was very quick, and he had been so miserable, so that was a big relief for him.
Very impressive, Rebekah.
This is very good medicine. It's definitely not for everybody, but for people who may not want to take Western medicine or may not tolerate Western medicine, there's a lot of stuff that we can do.
I can't thank you enough for being with us today, and your able helper, Marie. It's
Thanks, Marie.
very, very much appreciated. I'm sure our audience benefited from all this information. Thank you very much. See you next time on Boomer Beam.